Hi kids! Today we will see the discovery of Alzheimer in the show. Although Alzheimer was a very famous scientist, about 1901 he discovered the disease, one of the most famous diseases in the world, Alzheimer. Today we will see the case of Augusta Deter.
The history begins in a warm morning at Germany. Augusta was very active and worker woman. She loves to go from one side to another, doing her labors as teacher of physics at the German University. While in the medical school of the city of Berlin, Alois Alzheimer is a brilliant student. 4 years later, he graduated and started working in the dementia sanatorium in Frankfurt, a prestigious research institution, where he meets with Frank Nisi. He learned different historical procedures.
These samples of brain tissue are throwing very interesting data.
Yes, it is interesting, Alzheimer. This is how a simple tissue can show us different nervous disorders. Later, we will elaborate the document about the normal anatomy and pathology of the cerebral cortex.
Years later assumed the position of head of laboratory and pathological anatomy in the psychiatric clinic in the Munich, where he carried out several investigations, including the definite dementias. Meanwhile, in the life of Augusta.
Now that I retire, I can devote more to my house and to life with my friends.
Hey Augusta, you know you bought this sugar in the bathroom.
No, Sophie, how weird. I think it was Rodrigo. He is very distracted.
I think so.
I will go to the supermarket to buy the pantry. We have not gone, and there is nothing left for food.
Augusta, yesterday I went with you to buy the pantry, and we brought M4 for the month.
Did we really go? I don't remember. I forgot.
After several days, Sophia observed very strange changes in the behavior of her sister. Augusta, what are you doing? Why are you keeping the pan in your closet?
How? Is it not the kitchenware cabinet here?
Not, Augusta. Here is your room. What happens to you? You feel good?
I'm fine, just that a little anxious is everything.
One morning, Augusta was alone in the house when she received a call.
Oh dear, how you answer this thing?
Her sister arrived. Augusta, the phone is ringing.
Could you answer the phone, Sophia? I'm busy.
Hello, who speaks?
Hi, Sophia. I'm Carolina. How are you?
Hello, Carol. Very good. And you?
Very well, thank you. I want to invite you and Augusta to a meeting that I will have on the occasion of my son's graduation. It is next weekend. I hope you can come. On these days, I will send you the location.
Thank you. Of course, we will go. I will tell Augusta. Thank you very much for the invitation.
Not for nothing. Here we are waiting for you with open arms. Be well. Goodbye.
Meanwhile, in the room.
What happened at the party, Sophia? Why Augusta is so mad?
Oh, Carl, something happened with Augusta. She has been weird in the recent months. She has been seeing strange things. She has forgotten things and she has even lost herself. When she leaves, I had to go pick her up, and her even forgets how to use things or the where they are placed. But I did not want to tell you anything because I didn't want you to be worried about It forgive me.
Oh, Sophia, I had also noticed those behaviors of Augusta, but I thought they were normal. Lately, at night I can't sleep, and when I finally fall asleep, she has this terrible nightmare and starts screaming. I decide not to make a big deal about it, and she invents that I have a lover in her own house and that I had no shame.
This worries Carl. Augusta is not fine. She needs to be seen by a doctor or psychologist because this behavior can get out of control.
Yes, tomorrow will be another day. I'll try to be the hospital so they can make some study to solve her problem.
At the morning, Carl arrives to Sophia's house and make the call. Good morning, Frankfurt Hospital for Mental Patients. How can we help you?
Good morning, miss. I need to schedule an appointment, please. It's for my wife, Augusta Jeter. Tomorrow at first hour will be fine.
Yes, mister. I will give you the name of the doctor that will attend you. Carl says goodbye to Sophia and Carl returns to his house to continue observing the behavior of Augusta. The next day,
Get up, love. It's time to go.
I'm going, love. I'll be ready in a few minutes.
at the entrance to the hospital, Carl asks for the Dr. Nietzsche.
Good morning. I am the doctor who will attend you today. Who comes to the consultation?
Hi, doctor. Nice to meet you. This is my wife, Augusta. She's the one who comes to a consultation.
It's a pleasure, Augusta.
Is he the man you wanted me to know, love?
Yes, he is.
At the time of the consultation, Dr. Nietzsche found some very peculiar abnormalities in Mrs. Augusta, finishing the query.
Mr. Carr, your wife will have to be recluded here for observation. She requires special treatment since she is not longer able to perform her daily activities of the daily life.
A few months passed, and Mr. Carr visited Augusta every day, but saw no improvement.
Mr. Carr, we are treating your wife, but we don't know very well what she had. I will speak to a colleague of mine. Alois, my friend, how are you?
Hello, Nietzsche. How long has it been since I haven't heard from you, my friend?
I have many things to tell you. When do we need to chat? I have to tell you the case of the patient who is going to interest you a lot. I need you to help me with the Augusta's case.
Of course, yes. Tomorrow, if you want, I'll see you at the hospital to see the patient. The next day, Dr. Alois meets his old friend at the entrance of the hospital.
Look, Alois, the patient is called Augusta Dero, is 51 years old, and has problems of understanding and memory, as well as aphasia, disorientation, paranoia, unpredictable behavior, and psychosocial problems is an interest waste.
Of course, I got to see her to start my evaluation about the case. Alzheimer goes with Augusta and begins to ask a series of questions. She sits on the chair with an expression of helplessness. Mrs. Augusta. What is your name?
August.
Last name?
August.
What is your husband's name?
I think is August.
Of your husband?
Oh, my husband.
Mrs. Augusta sees the doctor for a long time, like she didn't understand the question. Are you married?
Yes, with August.
Are you Mrs. Derer?
Yes, with Augusto.
How long have you been here? It seems like she is trying to remember.
3 weeks.
What year is it?
1800.
Are you sick?
Second month.
Once the interview is over, Alzheimer's indicates an amnestic disorder of the writing, and the clinical history refers the patient's attempts in writing his name and of the city in which he lives. He also asks her to recognize the objects by touch with her eyes closed. When they ask her to read, she repeats the same line 3 times, but identifies the letters correctly, although she don't seem to understand what she read. A few months passed, and Alois treated Augusta, but due to the work issues, he had to move to another city, and he had already been appointed director of the brain anatomy laboratory. Nietzsche. I have to go to another city. I was given a position as head of the laboratory. I will continue with the treatment of Augusta's problem from there. Don't neglect her in the hospital.
Here, we will take care of it. Don't worry. I congratulate you on your new work. I hope you come back soon.
Months went by, and Augusta kept getting worse and worse, and she almost didn't walk, and she was sitting all day. That brought serious complications to her health. So years later, he died of pneumonia.
Thanks to this clinical case, it has been identified a new disease, the most common form of dementia, a disorder that currently affects tens of millions of people around the world.